Dialogue 1. Hygiene, Equipment, Risk Prevention. In this unit, you will learn how to ensure your working environment is clean and safe. Use the correct terminology for different equipment.
Hello, Leona.
Hello.
Nice to see you again. Welcome back.
Thank you.
Since this is your first week here, I'd just like to show you around so you can see where we keep all the equipment and you can become familiar with the space.
Okay, thank you.
I know you've been working in similar wellness centers for the last 3 or 4 years, but we may do things slightly differently here.
Oh, thank you.
Please don't hesitate to ask if there's anything you don't understand or if there's something you want me to go over again.
Of course.
Since we met last week for your interview, I already told you that we offer a full range of spa and beauty services, including facial and skin treatments, decorative cosmetics, hand and foot treatments, whole body treatments, and sports and relaxation activities through our pool and gym. You'll have the opportunity to work with our staff in each of the departments during your probation period. But for today, I'll just show you the main procedures.
Thank you.
So here we are in the reception area, and the first thing we need to make sure when the client arrives is to meet them and make them feel welcome. Depending on how busy we are, you may be responsible to do that and ask the client to wait in the waiting room until their room is ready. At other times, the receptionist will do this and will let you know when your client has arrived. Depending on the treatment of the guest, slippers and towels and robes will be given to the client at reception. At this point, the client is asked to complete a consent form and a medical questionnaire, which asks them to declare any existing medical conditions and to give you the names of any medications they're on. You may need to go through this questionnaire with them and make sure you get them to sign it. One of the questions is about allergies. It's vital that they understand this question and answer to their best knowledge. If they have ever shown any intolerance or allergic reactions to medication or makeup products. If so, we do a skin test to check for potential problems. You should encourage them to be as honest as possible so that we have a true and accurate picture of their current state of health. It's a bit like a risk assessment. We need to know the risk factor for each client. It's also important to check with female clients and ask whether they're pregnant or if there's any chance they could be pregnant, as this will obviously affect the oils you can use. Completing this form usually takes 5 minutes, so you can take this time to check if the room is ready. You need to check this form for any critical information that may affect the treatment before you start.
I'm sorry, but I'm not quite clear. Who asks the client to complete the consent form?
Oh, good question. Well, this might be the receptionist if they're on duty, or it may be you if you're welcoming the guests on that day.
Thank you for clarifying that.
So if you would like to follow me, I'd show you the treatment rooms.
Yeah.
So before they come in, it's essential that you assure that all work surfaces are clean. I mean, they need to be sterile and dry by the time the client comes in.
I see.
Also, before you receive your first client, you need to make sure that you are fully aware of our evacuation procedures. Every Tuesday morning, we will have a fire practice where we check that all equipment is in working order. So if you hear a fire alarm at any different time, you and your clients need to be aware that this is likely to be a real emergency and you will have to leave the building and assemble in the car park and follow the evacuation signs, just like you see here.
Thank you.
Another thing you need to ensure is that there are clean towels in each of the available rooms. We make sure that the rooms are ready in case we have clients that come for treatment without an appointment. We never turn away clients if we have time available for them. If the rooms are ready, we are prepared. Let me reassure you by saying we always recommend that our clients make an appointment, but never turn anyone away. It's also important to ensure that you've washed your hands thoroughly, that all the equipment has been sterilized, and that the rubbish from the previous client has been disposed of safely and hygienically to avoid the risk of infection and spreading germs around.
Excuse me, sorry to interrupt, but what exactly do you mean by disposed of safely and hygienically?
Disposed of safely and hygienically, I mean that it's important to use the appropriate bins. For example, for everyday rubbish, such as drinking cups and candy wrappers, please use this bin. Any disposable equipment like cotton pads or wax application sticks, you should use this bin, and any used towels that the clients had should be placed in a towel bin. That's no problem. So, moving on, it's very important to ensure that you explain the procedure the client will have and to double check they understood and that they are happy with everything. Over here we have the changing rooms where there are lockers and showers for the clients to use. If you'd like to follow me now, I'd show you the fitness room.